Today, we will talk about handwriting issues. Many primary grade teachers in elementary school and special education teachers struggle with children's handwriting difficulties. So many teachers believe, if they don't have a special education background and children's deficit informations, then they see those handwriting issues as a part of their attitude and behavior issues. They just refuse to work, so they don't want to write. However, we have students with real handwriting deficits. Then how can we teach these children? Even, we even think about we can teach children how to write, how to draw with their, pencils and with the fine motor skills. And especially in special education, many teachers are told to teach typing skills. So we think right away more alternative way of having these children to participate in school activities. So it is important because you have a limited, time, you have to finish your work and then move on to the next instructional topics. So you cannot just wait until child just labor handwriting and difficulties and finish their work. So we understand that. So you try to teach them and then still it looks like they just have no, strengths there. It seems like there are motivation issues or intention issues. So all kinds of issues together and they show difficulties. Then you just rather teach them to how to type. So whenever they have, worksheets, instead of writing, they can type. That is one of our issues these days because the teachers see children's any kind of deep difficulties. It seems like it's their disabilities, and then right away they believe they have impairment, permanent impairment. So there is no way they can teach. They can learn, not teach. They can teach, however, they don't learn or they can't learn. And many times they try to teach in the beginning. However, children do not follow them, and then they believe right away it is children's issues, their weaknesses. So I don't want to push them, pressure them, give them stress. So I rather just go alternative ways. So that is, I'm not saying that is really like a better choice. However, if you move on to the different way and alternative way, that means the child will not use their fingers to write and draw, maybe just forever. And then the child themselves, the children themselves will believe they cannot write because they have disabilities. So it is very important. That is a self-trust matters and self-efficacy and competence matters. So it starts with the handwriting. However, it's spread. So whatever they do and they don't succeed or just not successful, and then right away they believe I cannot do it. So it is more like a syndrome. I cannot do it syndrome. And so psychologically, mentally, it is important. The teachers really need to teach them and then let them just feel they can do it. So when child has handwriting issues, I had many children when I taught teacher, many children had handwriting issues, especially intellectual disabilities with that label has weak sensory-based motor functions. And then most of the children have a very sloppy handwriting, or it's very hard to read that much. Their handwriting is really not, clear. So first thing we do, we have to see if that handwriting is truly fine motor skill issues, or it is really their eyes. So it's like a eye-hand coordination issues, or visual attention. That eye is a visual attention and visual perception. So we have to make sure. So like medical doctors, teachers should check one, and then if that is fine, and then next one, that is fine, next one, like a medical doctor. So when medical doctor has a patient, they do different tests, and that test says all okay, and then they just keep testing until they find out what the real cause is. So teachers should have that kind of, beliefs and attitude and expectation. So we have to find, once you find that, causes, and then you can work on it, and then you can teach it. So handwriting is the same. Many people believe the handwriting is their manual hand finger skills. However, I see many children's handwriting is more eye that visual perception matters. So easily you can test. You just make 2 dots in front of the child. You make just with a marker, you say 1, and then you make a dot, and then 2, and the same, space, 2, and then you just make a dot, and then it's a 2-side. So let's say just I don't have a paper here. Let's say you have a let's say this is a paper and computer papers, and then you just make just a half, okay, and then make a line here in between, draw a line, and then make a 1 dot here, and then 1 dot here, and then 1 dot here, and then 1 dot. So one side is a teacher's side, the other side is a child's side. So you see it with the child across the table, not just side by side, and then put the paper down, and then with a marker, big marker, and then make just a dot here, 1, and then 2, and then make a 1, and then 2 side, and then you hold the red pen or red marker, small one. It's like a small tip, what is the fat tip, pen, and then put the 1, and then you cross 2 in front of the child. You do it, and then give the child the pen, and then ask the child to do it, and then you point it, and then 1, and the child will put the pencil, there, and then just draw. So in this way, you do it. It does not matter how far these dots are. If a child has a visual attention problem or visual perception, and then child can find this first dot because the teacher pointed, and then when you move, child so the teacher's line went here. Child would do that, but child does not see this dot. It's amazing to see how child could not see this, and then line goes like in the middle, stop, or go this way, go that way, because the child saw the line. However, child did not see clearly which way this line went. So the child line could go this way, whatever way is. The child can make a line. That means the child has hand that strength here. Okay, so either way, finger skill is the same. Either it's too weak or too strong, and then they push it down, and then too much just press down, and then they almost rip the paper, or it's too light. Okay, so this is the one way you could easily, the child has fine motor skill issues or visual attention. These fine motor issues are 100%, almost 100%. I'm not OT, so, but through my experience, almost this fine motor skill is a sensory-based motor function. So it's not real finger motor skills, it's a senses. So you have a fingers, so you have a hands. However, when you poke, it's all these senses, right? So when child just you do with the child this finger movement, and then 1, and then you just open the hands, open, and then see child can do, just follow you. And this is another eye-hand coordination. So child saw your hand, and then child can make their hands, not like this, open. So easily, many ways we can check. So you may think, this is handwriting issues, and then why we do this? Because most of handwriting children's, it's not really labor issues, so their laziness or their latency issues. Many times, children's when they have a visual attention, visual perception issues, they don't see what we are seeing. Okay, so it looks like it's not their eyesight issues, it's their conscious eyes. So they see the figure ground, those dots I made, it's like a figure ground, and then visual spatial. So on the paper space, and then there's two dots, and the child does not see it. It is very just I don't know how to explain this. However, when you do dot line connection and then many dot lines, so slowly, if a child does not see it, it does not mean you gotta stop it. You work on this, so you can start from this two dot connections. Okay, so in the beginning, just like left to right, top down, diagonal corner to corner, and then make different shapes. It's all dots with dots. So in the beginning with two dots, and then gradually you increase those directions, more different directions, and the number of dots. Always you do in the same space. Teacher does one, and then child does next, and then they clearly see the teachers, and then you believe they can copy it, but they can't if they have a visual perception issues. So gradually, this is two things. We remediate their visual attention deficits or the visual perception deficits, and then they practice these senses. Okay, so what is that? Sensory motor, sensory-based motor functions with the fingers. So they, practice gradually, and then later on they can see clearly, because some children could write it, but they just overlap. They don't see just each letter, any space. That is almost 100% is a visual perception. Visual attention is a low level of visual perception. Visual attention is more like, small features, but visual perception is more like a big figures in the space, on the ground. That's a visual perception, but visual attention. So we start with the visual attention. So two dots connections, and then three dots connection, and then four dots, and then make a shape. So that's gradually we move on. That's we start from visual attention, and then we move on to the visual perception. And then 100% the children can write. They can learn how to write those handwriting skills. So I really beg teachers, don't just move on to alternative method right away. Okay, that means you already defined that the child cannot learn, and you believe it's a child because child has issues. But to me, it is I can tell the teacher, do you think you cannot teach it? So it is important, it's all about the perspective. So as a teacher, you believe you can teach it, and then you will diagnose the child. So I call this one diagnostic education and diagnostic teaching. That means that you are in the medical doctor's position. So your education doctor's position, you just find the main causes of those issues, and then you start from there. So outcome is handwriting. Okay. However, what's the causes of these handwriting outcomes, behaviors? So that is a visual. It could be visual attention deficits, or it could be sensory-based motor function deficits. Okay, so different way of deficits, but these handwriting almost these two, okay, either one or both, but most of the cases are both. And then many cases, the children, because they didn't see it, young children, 2-3 years old, has already started scratching, right? With whatever just pens they see, pencils see, and markers see on the wall and everywhere they scratch. That is the children's basic motivation. That's all intellectual curiosity. So they testing those themselves, their motor skills. However, children don't do it. That means they don't get those intellectual curiosity. It's not intellectual issues because they don't see the figures and object clearly. So they don't have those intellectual curiosities. You see it and then you are curious. You see the pen, they know this is a writing utensil and they want to test it, right? However, children don't see this and then they don't understand the function of a pen, and then they don't have those curiosities, and then they don't practice. Those children, we have to intentionally do those 2 years older, 3 years older experiments. We do 5 years old and 6 years old, 7 years old, even 10 years older. So we go back to those beginning and start from the causes of those outcomes. Okay.